Hi everybody, this is take 3 of The Stir coming to you from the Stir chair, and it is Friday night and we have about an hour left of Friday because then I got to get this up on YouTube or else I'm lying and it'll be Saturday. But I am frustrated as heck because this is the third take. The first take was, on this camera, which decided for some reason not to work. Nice video camera that I just bought. Anyway, the second time I got all the way to the end and the memory ran out on the card on this camera. So here we are, take 3, and I hope that I can repeat my performance. And I'm not only frustrated about the camera because there's other things going on. I was sick earlier this week and I'm frustrated about that, and I'm frustrated because I missed seeing Johnny Resnick play at the Beacon Theater tonight with OAR and with the Counting Crows guy. It is so irritating and it's so sickening to know that that's going on right now. People are probably standing up to give it a standing ovation to Johnny, and he's looking really hot and really good and sounded excellent, and I'm not there. So, but whatever, it is what it is. I'm here in my apartment, and I'm glad to have my apartment, and I'm glad to have my kitty cat as big as he is. Oh my goodness. Yeah, and tomorrow I was going to film my respiratory assessment comedy routine on the Brooklyn Bridge Park, and with the Brooklyn Bridge behind me in Manhattan, but that's not happening either, obviously. So Azzy here helped me out with filming neuro assessment the other day, and it's, like I said, kind of hard to do that with a cat, but whatever. I think he gets a 15 for his glaucoma scale in kitty terms, right? Even though he can't talk. But anyway, today I'm going to do cardiovascular, and it's the same thing. When you, if you're a nurse, this is just, not Laura Gasparis talking here. This is just me, trying to be funny, trying to be a little entertaining, and I have nothing else to do tonight but talk about the cardiovascular system. So that's what I'm going to do. So you walk in and you see your patient, and you can tell just from walking in the door if your patient's got some issues. If you were walking in right now, you would see me sitting in the chair talking and laughing, and if you looked at Azzy, you would see that he's purring and that he's doing pretty good. His eyes are nice and bright. You can't really assess skin on a cat because I guess they're covered in fur. But on a person, you can tell right away from the door, like, are they pale, are they pink, are they gray? One time I was working at a hospital nearby, not at the one that I'm fully employed at, but many years ago I got report that this lady was very demanding and very insistent and very angry. And I didn't want to go to see her first. I wanted to go see one of my other people. But when I was walking by her room, I could see that she was gray, and she was just kind of laying there like that. So I could tell, and usually when you see something like that, it's cardiovascular related. So I went into her room first with an oh shit attitude, like, oh my God, here we go. And I called the doctor because at that hospital, there was no doctor around. Not like at Hershey where there's residents, but so then I felt her pulse. She was arousable and stuff, but I felt her pulse and she was very weak, and so she would you're so insistent. Oh my God, you want to be part of this, huh? But you know what? If I examine your gums, which is what the vet does when they're checking cap refill, you would bite my hand so fast and I would get cellulitis and my hand would eventually get all stinky and swollen and painful and rot off. So no, I'm not going to stick my hands in your mouth to show people your gums and how pink they are. So anyway, the vet just kind of does one of these. So yeah, so you check their color and their capillary refill, and that tells you a whole lot about the patient. So then after you do that, you check their pulses. And you check the pulses here in the wrists, and in the case of that lady, I felt her neck, but that's you don't do that to people normally because it's kind of creepy. But you check their hands and their feet, and it should be nice and strong, good strong pulses. I can feel Azzy's pulse back in here. So then you, if you have a person with peripheral vascular disease, they might be healthy, so to speak. but they might have really bad pulses in their feet because they don't have circulation, especially, if they're heavy smokers. So don't smoke, because you're going to get no circulation to your feet, and then you're going to get a wound on your foot, and then you're going to get all infected and gangrenous and disgusting and gross and have to have your legs cut off. So no smoking, and watch that blood sugar. So then what you do is you print your strip. If your patient's on the monitor, you print a strip, and you got to have that in the chart as a record. So, and when I mean strip, for all you non-medical people, it's not strip tease, like, baby, it's not that type of hanging onto the pole. It's a piece of paper that you print off the monitor. And when you print your strip, you look at the PR interval, which is tells you about, here's my little drawing of the heart. These two chambers of the heart, so then that should be like 0.16-ish if you're healthy. And then you look at the QRS, that's when these two ones squeeze together. And they cause a big spike. That's the spike that you see on the EKG, if you're, like, even people that are not medical have seen it. And then when these relax and fill with blood again, that's when you get the QT interval and the T wave. So you measure all that stuff, and your QT should be 0.08, and your oh my God, no, you'd be in trouble. Your QRS should be 0.08, and then your QT interval should be like 0.36, 0.40, and you count the little blocks. That's how you get those numbers. Yeah, I'm over your head. I'm sorry. But yeah, and you nurses that I've worked with, come on now. You're like, oh, she's so dumb, she's so basic, and she missed a couple of points, and that's not how it's done. Well, shut up. So back to what I was saying. Then you get your stethoscope out. You see my nice Littman cardiology. I'm so proud of it. It's only the second stethoscope that I've had that's been worth anything. And you put it in your ears. And now, oh my God, my voice is multiplied by 10, and it's like I'm underwater. Then you take the diaphragm of the stethoscope and you put it right here on your patient, over a little bit to the right, and you can listen to a heart sound there, and then you can listen to one here, and then you can listen to one here. This is called the apex, right over your left boob. That's where you can hear this ventricle the best. So, but you listen, and you're supposed to hear the thump, the thump, the thump, the thump, the thump, and the is what we call S1, and that's when these two valves that are right here, kind of in the center of the heart, are closed. So the ventricles are filling during that point. And then you'll hear the thump. That's the S2. And that's when these two valves slam together, because there's a lot of force required to get the blood out of those ventricles. And then you might hear and that is a murmur. And if you're like me, you have a murmur because one of your valves is not working. I have pulmonary hypertension, and it causes this pressure right in here to get really high, and then blood shoots back up through this way, and it's not supposed to go backwards. So when you hear a murmur on your patient, blood is going backwards at some point. But mostly, in most people, as they get older, it'll be this valve. So there's something wrong with your valves if you hear and sometimes you'll get like extra heart sounds like S3 and S4. And I'm not a cardiologist, so I'm not even bothered with that. So, yeah. So then, you ask your patient, are you having any pain? I think we've been through the pain thing a few videos ago. But if they say they're having chest pain, that is like red alert, like right on, call the heart, like get an EKG, throw some nitro under the tongue, see what happens, check the blood pressure. If you don't check the blood pressure first, you might kill them. And if they're taking Viagra, you'll kill them. So you got to ask those questions. And then if they go unconscious, you start CPR. So anyway, that is my cardiovascular assessment. My cat, was kind enough to come and join me for a little bit, and Thank you, Aslan. He's sitting on the floor. He was supposed to be my victim. I was supposed to listen to his S1, S2, which would be like, because cats have a fast heartbeat. Anyway, so John Resnick is putting his guitar away right now. And I'm just sitting here waiting for the pictures from other fans that have been there. Yeah, I will not be broadcasting my respiratory assessment from the Brooklyn Bridge with Manhattan in the background like I was planning. But life is life, shit happens. And thank you very much otherwise. Namaste.